Welcome to the self-evaluation episode of the ASCO University Weekly Podcast. My name is Suresh Ramalingam, and I am Professor of Hematology and Medical Oncology at Emory University and the Deputy Director of the Winship Cancer Institute of Emory University. Today, we feature a self-evaluation question on clinical research methodology, clinical trials, phase 3. We begin by reading the question stem. A multi-center global phase 3 trial of an immune checkpoint inhibitor combination is launched. Eligible patients include those with advanced stage non-small cell lung cancers previously treated with first-line platinum doublet chemotherapy. Patients with a history of autoimmune disease are excluded. Patients are randomized to treatment with docetaxel or a combination of nivolumab and SX56, an inhibitor of LAG-3. The primary endpoint of the trial is progression-free survival, and secondary endpoints include overall survival and best objective response. A projected total of 300 patients are accrued to the study, and an interim analysis ensues. Objective responses were noted in 25% of the patients in the immunotherapy arm and 8% of patients in the docetaxel arm. In order to determine the primary endpoint for each patient, survival is measured from the date of treatment until which of the following dates? A. Date of death only. Option B. Date of disease progression or death. Option C. Date of disease progression only. Option D. Date of discontinuation or disease progression. Option E. Date of treatment discontinuation only. The correct answer is option B. Progression-free survival is a common endpoint in phase 3 clinical trials. It is typically measured from the date of treatment initiation until the date of disease progression or death. This endpoint describes the immediate therapeutic effect of the intervention under study and is not influenced by other factors such as post-study therapy. Option A is incorrect since it measures only up to the date of death. This is used for trials with overall survival as the primary endpoint. Including only the date of disease progression, as in option C, will exclude patients that might have died of disease progression without assessment for progression or from toxicity related to study treatment. Option D is incorrect since date of treatment discontinuation alone could exclude patients that went off study without experiencing disease progression and could actually have been benefiting from therapy. For the same reason, option E is also incorrect since it will only measure date of treatment discontinuation. Thank you for listening to this week's episode of ASCO University Weekly Podcast. For more information on the clinical research methodology, including opportunities for self-evaluation, visit the Comprehensive e-Learning Center at university.asco.org.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.